Hello and good afternoon. Welcome to today's COVID-19 update with the county's public health experts coming to you from the safety of their private offices. Today, you will hear from the county's Director of Public Health, Dr. Vondo Reynoso, and Dr. Henning Ansorg, the county's public health officer. Following their updates, we will open it up to questions from the news media. This press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language by Julia Townsend. Videos of the press conference will be available shortly after the conclusion of the press conference in English and Spanish on the county's YouTube channel at CSB TV 20. And with that, I will turn it over to the County Public Health Director, Dr. Vondo Reynoso.
Good afternoon, everyone, and happy Friday. I'd like to begin the press briefing with a huge kudos to Santa Barbara County. Thanks to your efforts, our case rate decreased by 41% over the past 2 weeks, and we are now in the orange tier, and that is much to be celebrated. This means more businesses are now able to open indoors with modifications. However, in order for us to stay in the orange tier, we all need to continue masking, physical distancing, testing, and getting vaccinated as soon as possible so that we can continue decreasing the spread of COVID-19. Next. The data in this slide represents Santa Barbara County's efforts. Of the doses received, 299,769, 154,109 first doses were administered. 87,642 second doses were administered. 9,983 single dose Johnson & Johnson or Janssen vaccine was administered. So altogether, we've administered 84.1% of the doses that we've received. The remaining 15.9% of our allocation has been committed towards upcoming appointments. Next. So altogether, 42% of Santa Barbara County residents have received at least one dose of a 2-dose regimen, and 27% of our population are fully vaccinated. Next. Just want to remind everyone that community members 16 plus years of age are now eligible at the community vaccination clinics using Pfizer. We are requiring written parental consent and recommending that parent or guardian accompany the minor if possible. Next. With regards to vaccine distribution, first dose appointments for most locations in Santa Barbara County can be found in My Turn. Second dose appointments remain available countywide. I'd like to highlight upcoming clinics available through the Public Health Department. These are first dose community clinics, and they are next Tuesday in Santa Barbara and next Wednesday in Santa Maria. There are, we will accept walk-ups. No appointments are needed. So again, you can decide at the last minute to seek a vaccine in Santa Barbara, and you can do so in Santa Maria as well. However, if you would like to schedule an appointment, you can do so via My Turn or call 211 and select option 4. Next. With regards to doing everything we can to increase vaccine access, we are so appreciative, so grateful that our community partner, Herencia Indígena, have created tutorial videos for community members on how to access and use My Turn in Mixteco dialects from Oaxaca and from Guerrero. And so I've included the 2 links to the YouTube videos that will walk community members through using My Turn. And I encourage all of you to share this widely. If you know, if you have family, friends, if you have clients who might find this helpful. Next. Also, to increase vaccine access, we have formed 5 mobile teams available to provide 50 to 300 Moderna vaccination at on-site, at work sites, housing facilities, places of worship, warehouses, and at community organizations. It is a very easy registration process, and we will assist the community partner. If you are interested in hosting a mobile site, please contact us through Mobile Clinic at sbcphd.org for more information. And just want to note that these 5 teams are bilingual and can travel throughout the county, but we do have 3 based in North County, 1 in Mid County, and 1 in South County. Next. I'd like to end with with this slide. I'm so happy that we are in the orange, but the fight is not over. And we need to continue to be diligent. And so please continue to wear your mask, maintain your physical distance, get tested if you have been exposed or if you're worried, and please get vaccinated as soon as possible. Thank you. And with that, I'd like to introduce you to Dr. Ann Sorg, our county's health officer.
Thank you, Dr. Dorinoso. Good afternoon, everyone. We are really glad to report that for Santa Barbara County, the scarcity of vaccine supply does not seem to be a problem anymore. As a matter of fact, we have noticed that not all vaccination appointments are filling up at our sites in North County or at Cottage Hospital in South County. We still have not achieved our goal of vaccinating around 80% of the population. We know that there are quite a few individuals who have not yet decided if they want to get vaccinated or not. Maybe they have some concerns about the safety of the vaccines. Please rest assured that we are taking the safety of the vaccines very seriously. Any adverse event is immediately reported to a national database called VAERS, which serves as an early warning system for potentially vaccine-related problems. Just very recently, it showed how well this works. After 6 cases of a rare blood clot that were reported after 8 million doses of the J&J vaccine had been given, and the CDC recommended to pause the J&J vaccine to have time to investigate these rare occurrences. As we speak, the ACIP from CDC is still deliberating what to recommend at this point. Especially on social media, there have been several alarming reports that vaccines would be harmful. I would like to address some of those concerns today. Number 1, regarding fertility. The Pfizer and Moderna vaccines are not affecting fertility at all. In fact, many women who participated in the clinical trials of these vaccines in 2020 and many patients who have received the vaccine after that have since become pregnant without any difficulties. Number 2, what about pregnancy? In the initial trials, pregnant women could not be included. However, A recent study that was just published this week in the New England Journal of Medicine confirmed that the Pfizer and Moderna vaccines are safe during pregnancy. We are very relieved to learn that pregnant women and newborns will be protected from COVID if the mother gets vaccinated during pregnancy, and that the vaccination does not pose any risk to the newborn. Number 3, even if you had COVID before, it is still advisable to get the vaccine because the protection through a vaccine is higher against mutated versions of the virus called variants. Additionally, it appears that the immunity triggered by the vaccine is more robust than the natural immunity conferred by having had the viral illness. Number 4, long-term effects. So far, no long-term adverse outcomes have been reported. The first Pfizer and Moderna vaccines were given during the clinical trials that started in March of 2020. And between July and December of 2020, over 50,000 participants had received the vaccines. So we are now 13 months after start of vaccination, and we have not seen any long-term adverse outcomes. Number 5, vaccination reactions. Yes, there are some short-lived effects like headaches, body aches, fever, pain, and swelling at the injection site. However, these usually last for maximum 1 to 2 days, and they can be treated with Tylenol or anti-inflammatories like Advil. These reactions actually show that the vaccine is stimulating the immune response in the body, and they're expected. They do occur with other vaccinations as well. Severe allergic reactions, called anaphylaxis, do occur very rarely in people with a propensity for such severe allergic reactions. These events have always been managed with appropriate use of an EpiPen, other allergy medications, and only sometimes needed additional observation at the emergency room. All cases of anaphylaxis in Santa Barbara County recovered quickly with appropriate management. We do screen every single candidate if they have a history of anaphylaxis prior to vaccination. And if they do, we pay attention and observe them for at least 30 minutes after receiving a shot. Number 6, the speed of vaccine development. It is true. The speed by which the COVID vaccines were developed is astounding. Please keep in mind, though, that the underlying biotechnology of the mRNA vaccine and the other viruses has been studied for at least a decade, and that no corners were cut in completion of the mandatory phases 1, 2, and 3 necessary to gain FDA authorization. I would like to emphasize that all 3 vaccines used so far have shown to prevent severe COVID and death from COVID completely. If a very small percentage of vaccinated people were to still get infected, the symptoms will be mild and will rarely require hospitalization. The faster we get as many people vaccinated as possible, the better the whole community is protected against spread of more dangerous versions of the virus that are currently circulating in India, South Africa, and Brazil, among other places. It is only a question of time that these more aggressive forms of the virus will arrive here as well. The best protection we have is to get immunized as soon as possible. I would like to encourage everyone who's still on the fence about whether or not to get the COVID shot to please go ahead and take it. I hope I could address some of the concerns people may have. We are very happy to respond to any other questions or safety concerns of any of our residents. Thank you for your attention.
Thank you very much. And now we will go to questions from the media. First up is Blake Devine with KYT. Blake, go ahead.
Hi, guys. First question for me. I know Vonda Reynoso spoke briefly a little bit about it, But I had a question for Dr. Ansorga, just talking about how this move into the orange tier this week kind of symbolizes how far we've come as a county from the darkest days being in January and December to now where we are. Just speak a little bit about how it kind of defines how our whole community has bonded together and we're reaching and going toward a positive direction.
Yes, I think you put it in very beautiful words. The community has definitely grown together, and we haven't seen low case rates like this since September. Prior to the fall surge, we've never made it into the orange tier, so we have never seen ICU admission rates of 10 or 12 today that low. Since September. So I just spoke to one of our main infectious disease doctors and they just said, I just really hope that I will never have to deal with like more than 100 people in the hospital with COVID and having to tell patients that they are going to die. And it has taken an immense toll on the medical community, but obviously on everybody else in other ways as well. And I think we've come a long way. And I'm just really wishing for all of us to get through this all together.
And then what's the latest on the virus variants and how many of our new cases can be possibly classified as variants?
Well, we are obviously not testing every single positive initial test for a variant because it's a cumbersome test that takes time, sometimes 3 to 4 weeks until we get the results. So we are prioritizing certain test results, in particular patients who had been fully vaccinated but then got sick with COVID. We test those for these variants if they have a variant of concern or of interest. And we have been fortunate so far that the vaccine breakthrough patients that we have seen have not had any of these very dangerous variants like the South Africa type or the Brazil type. So I'm keeping my fingers crossed. I'm really hoping that these more aggressive variants will not be able to take hold here. And so locally, they are arriving, these nasty variants, but they haven't caused any known infections to fully vaccinated people that we know of.
Makes sense. The goal, you said, is to vaccinate 80% of the population. Would that be herd immunity levels for Santa Barbara County if we got to 80%?
The number is controversial under many experts. We have to take into account the naturally occurring immunity after recovering from the illness. So I will also take that into account when I talk about I would like for 80% of the population to be vaccinated. Then I think we have some padding with the addition. If some people who don't get vaccinated had COVID maybe and have natural immunity, but the jury isn't out if we need a total of 75 or 95% of people with antibodies against the virus. So I think 80% is somewhere in the middle.
Makes sense. Last question for me. We have some viewers asking if there are any plans to create a designated vaccine clinic for UCSB students in Isla Vista.
I refer to Dr. Dorminoso on that.
Hi, Blake. That's a great question. As a matter of fact, just this morning, my team met with UCSB to have that conversation. So for now, UCSB community has two options. One is the robust availability of appointments at the Cottage Goleta drive-through. And not only are there plenty of appointments, but Cottage Hospital has created a walkthrough bike through, as well as, of course, you can drive through. So that is our primary focus and encouragement to the UCSB community to fully utilize currently available appointments at Cottage. But in addition to that, we are going to support UCSB community with our mobile clinic, and we are working through the available dates and hope to bring a mobile clinic. So very finite number of appointments somewhere either on campus or in IV. So I anticipate that clinic to happen either this week or next week.
Awesome. Thank you guys so much.
Thank you, Blake. And next up, we're going to Tom Bolton with News Hawk.
Good afternoon. Thank you very much. I have a couple of questions today. You continue to urge people to get tested, but at the same time, more and more people have been vaccinated. And so I'm wondering kind of how those two factors play together, if you will. I mean, why would somebody who's been vaccinated need to get tested, and what does that do to your testing metric?
Yeah, let me take a stab at this, Tom. It's a very good question. People who are vaccinated and who have been in contact with somebody who has COVID, for instance, and they feel fine, they don't have symptoms, they do not need to quarantine and they do not need to get tested. So I would like to be very clear about that. People who are fully vaccinated, that means 2 weeks after the last shot or the only one shot, from the Johnson & Johnson, are considered safe because it's very, very rare that they actually get reinfected. Now, we do, unfortunately, as you saw the numbers earlier, we have a very large percentage of the population that is still unvaccinated. So if they got in contact with somebody or they went to a gathering and they feel a little bit uneasy about their status or they have been traveling, we ask them to test. And that's why we are still not completely out of the woods. Testing for unvaccinated people remains a very important tool to identify sick people that can spread the virus quickly. And even asymptomatic people, people with no symptoms, more than half of everybody who spreads the virus feels fine. So that's why we encourage people who are not vaccinated to get tested if in doubt.
Okay, so it's primarily the non-vaccinated that you're targeting at this point.
Absolutely.
Okay. The FDA and the CDC just a little while ago this afternoon signed off on the resumption of the J&J vaccines. So I'm wondering what people can expect in terms of when and how that might return in Santa Barbara County.
Well, that must have happened in the last 25 minutes because last time I checked was 20 past 4 and I couldn't find any.
It literally just happened, I think, like within the hour, certainly.
Please allow me to review the data before I make any comments on that.
Okay, that's fine. I'm wondering, we're about 3 weeks out from Easter and spring break, and I'm wondering what, if any, impact you saw from that in terms of numbers of cases.
We did see a little blip, and that, I think, caused us to cross the line towards orange 2 weeks later than expected.
Do you feel like that blip has sort of run its course at this point?
It seems that way.
Okay. And my last question, if I can circle back to vaccine hesitancy, I'm just wondering if there's a predominant reason that you're hearing. I know I'm sure it's anecdotal on some level, but a predominant reason you're hearing for people not willing to get the vaccine at this point.
Yeah, that's a very good question, and we are investigating. If you hear of any other reasons than the ones I mentioned earlier, I would be very interested to learn about that. So it's a very wide spectrum of concerns. Usually, it's safety concerns, and that's my understanding so far. But I'm more than happy to learn about why people feel hesitant to get the vaccine.
Are you seeing it in any particular identifiable groups, or is it truly across the board?
That's a very nuanced question. There are, I mean, it's been in the news nationally, and we are seeing. I mean, if you look at our demographic data, that Mid County has less vaccination percentages than the North or the South in Santa Barbara County alone. So it is definitely regional. There are polls out that more conservative communities feel more hesitant, more drawn to declining the vaccine. Also, men usually are less willing to get vaccinated. Us men are probably chickening out because of the needle. That's the only explanation I have. So there are various reasons, and it's really quite fascinating or mind-boggling to see. It's not one size fits all.
And I think that's why, Tom, we have really invested in our partnerships with trusted community leaders. So in North County in particular, we have partnered with trusted community leaders from all different sectors so that they can be our partners in promoting the need to get the vaccine. And we just want to encourage everyone listening to this press conference to help us and be our partner and encourage your family, your friends, your loved ones to get vaccinated. I think it's going to take all of us to be encouragers, to be available, to answer questions and point them our way, point them to our website if there are any lingering concerns or questions.
All right. Thank you very much.
Thank you, Tom. And next up, we're going to Laura Place with Santa Maria Times.
Hi, everyone. Thank you. My first question has to do with second doses. I was wondering if you could explain for people what they should expect if they made their first dose appointment through My Turn. Will they make their second dose appointment at the same time as their first dose? Will they receive an email later on? What can they expect for that process?
Vaughn, do you have an answer for that?
I'm sorry, I'm not Vaughn.
It's okay, Dr. Einstein, go ahead.
My understanding is if you made your first appointment in My Turn, you will get notified before the 3 or 4 weeks are up to make your second appointment. Now, if you had your first appointment and it was scheduled with the old platform through receiving the link, then your second shot will also be scheduled in that way. The same if you had it through Cottage or other vaccination partners. I hope that answers the question.
Sorry, I was on mute. Yes, that is correct, your response.
Okay, so when you say they'll be notified, well before their second appointment, will that be a notification from My Turn, if they provided their email, or through public health directly?
So, I'm sorry. So I just got clarification, apologies. But when community members make their first appointment in My Turn, they also at the same time make their second appointment.
Oh, okay.
Does that make sense, Laura?
Yes. And then if they had their first dose appointment, prior to this widespread switch to My Turn, then they can expect an email about scheduling a second appointment.
That is correct.
Is that right? Okay, thank you. There was some confusion there. Also, regarding second doses with the mobile clinics, how are people getting those second appointments scheduled? And will it be at the same site, just, within the appropriate amount of weeks since the first dose?
Yes. So we have a team totally dedicated to scheduling the appointments for the community members who participate at that clinic. And we will support community members if they can't make it back for their second clinic at the same site. We will work with them and make sure that they complete their series.
Another question. As far as the mobile clinics, how many people do you estimate so far in the county have been vaccinated through those clinics?
I don't have this week's numbers, but within the first 4 days of us running the mobile clinics, we vaccinated over 1,000 people.
Okay. All right, thank you. And lastly, I know we were talking a bit about just how rare it is for people to end up contracting COVID again after they've been vaccinated. But we have seen some cases of that, like in SLO County. So I was wondering if you can, speak to how many of those cases you have seen in Santa Barbara County.
I don't have the exact number. It's anywhere between 5 and 10.
Okay. And have the cases been severe or pretty mild?
Only very mild, usually. Only a few needed hospitalization, but nobody ended up in the intensive care unit, and the hospitalizations are usually very brief. So it's very different scenario from the original infection.
Okay. And what can people do just, after they're vaccinated, just to keep protecting themselves from the possibility of getting sick again, even though it's a pretty minute possibility?
Well, the safest socialization, getting together and meeting is with other vaccinated folks, obviously. Now, then, if you are with people and you don't know their vaccination status, even if you're vaccinated, I strongly advise to keep wearing your mask. If you're indoors, for sure. And if you're outdoors and cannot keep a 6-foot distance, then also, by all means. In addition, any outdoor activity is much safer than indoor activity. So that's what I would keep in mind also, if you're vaccinated.
All right, thank you very much.
Thank you, Laura. And last up, we're going to Fabiola Navarrete with Two Tiempo Digital. Go ahead, Fabiola.
Good afternoon, everyone. Okay, my first question, I don't know if you have information about what percentage of Hispanic population has been vaccinated, and if you have seen some bad reactions to the vaccine within this population, and what types of reactions have been reported.
So I'd like to draw your attention to our website, which does contain a lot of really good information on the COVID-19 vaccinations. We do break it down. Our epidemiology team breaks it down by race and ethnicity, by region, by percent of population. And as of today, we have 32 of the total number of people that have been vaccinated in our county. 32% self-identify as Hispanic or Latinos. And I will defer to Dr. Ansork to see if he is aware of any concerns or out of the ordinary reports from the Latino community with regards to reactions and side effects.
Thank you. Okay.
Yes, I'm happy to report that I was not made aware of any significant bad outcomes in Santa Barbara County. We have given, it's close to, please correct me if I'm wrong, Vaughn, but I think it's close to 300,000 doses now. It's like an immense number of vaccinations. And yes, people have a sore arm and so forth, but these horrible allergic reactions where somebody feels short of breath and so forth have been really a handful, and they were treated immediately, successfully, and it's expected also with other vaccines. So no, The Hispanic population has not suffered any worse side effects or vaccine reactions than anybody else, fortunately.
Okay,
Yes.
thank you.
Yes, again, we have given 318,072 doses. And again, want to invite you to visit our website at Public Health SBC under the vaccinations tab. There's really a lot of wonderful data.
Okay, thank you. My next question is regarding again about the J&J vaccine, because I also heard that the 11 days pause for this vaccine has been lifted, but you told us that the CDC are still discussing. So the county is gonna wait until the last decision on to decide that if you're gonna keep applying this vaccine in our county.
Yes, I think we have to wait until we can get the full information, because it literally has apparently come out half an hour ago. And then we will, utilize it as recommended by the CDC.
Okay, and my last question is about the survey that the Public Health Department did. I just want to know if you know through this survey what percentage of the population doesn't want to get vaccinated and what the reasons are.
I only have rough estimates of the percentages. We know that there's around 20% of people who are categorically against vaccinations in general, whether it's influenza or pneumonia shots or anything. They're just against vaccinations for various reasons. And then my understanding was that almost 60% of people definitely want the shot. So that comes to around 80%, and 20% are what we call on the fence. They haven't quite decided. They are not against the vaccine in general. They just feel a little bit uneasy, or they have some concerns that hadn't been addressed so far, or convenience, or other reasons. And these 20%, that's where we really want to make an extra effort to go the extra mile to bring it to them if transportation or convenience is an issue, and also to debunk false information that is unfortunately spread on the internet, on social media, and so forth. So we are reaching out to those people who are still undecided, and that is somewhere between 20 and 25%.
Okay, thank you so much.
Thank you, Fabiola. And that actually was our last question. And that concludes today's press conference. Just so everyone is aware, the Board of Supervisors will not be in session this coming Tuesday, so there will not be an update in front of the board. However, for ongoing information and links to the information such as that our doctors here today referenced at publichealthsbc.org. It has a great resource as far as daily updates and information. Check out the community dashboard. In addition, every Thursday, our public health experts are featured in the 11 a.m. news broadcast at KYT with any live and breaking information. And that concludes the press conference. If you need assistance with vaccine appointments, call 211 and select option 4. Have a safe, healthy, and happy weekend, everyone. And tune in next week to our social media and our website for ongoing updates. Thank you.